Glenn, thank you. It's a delight to be here amongst a number of friends and people like John that I know well. I did receive the round robin on the dress code, but for an Asian bald bloke, wearing orange, you kind of get associated with slight, religious orders. So, forgive me perhaps for wearing a shirt and tie and being a little conservative. Your timing, Glenn, is impeccable. So you are clearly at the heart of government decision-making, given that the GS1 conference has been publicised for some time now. And I was at the conference last week with you and heard the speeches. John's given a very detailed and candid exposition of what the challenges are, and I understand all of those. And within a fragmented customer base, you guys don't need me to tell you all of this, within a fragmented customer base, where information is scarce, that's a challenge that I know is that John and his team are striving towards. So this is about value and about how systems and people like my industry can all collaborate to kind of drive this call to arms that is efficiency. It's a number of challenges ahead, but I think collaborating together we can move forward on this basis, particularly where detailed analysis is required on a comparable basis to make meaningful decisions. So really 3 points that I'm going to talk about over the next, I guess, 15 to 20 minutes. I've got a handful of slides. I'm not going to take up too much of a time, and I know that we want to kind of get some questions into the agenda as well. So a little bit about my organization, who we are and what we do. I see a number of my members here, but I'm sure there's a number of people here who don't perhaps know ABHI. I've been asked to kind of give you a bit more detail about industry, specifically the e-procurement strategy. Clearly, things are moving on at pace, and I'll kind of bring into that some other aspects as well, and some pieces around next steps as well. So I don't know if you know ABHI. The acronym stands for the Association of British Healthcare Industries. We are the trade body for the medical technology sector. That's a pretty diverse community. And therein, in effect, lies some of the challenge with regard to some of the work on the efficiency agenda as well. We're talking about multinational companies all the way across to a long tail of British-based SMEs. In our membership, we've got something like 180, 200 companies that span that huge cake of diversity. Our mission is unapologetically about business. It's about how we help our members do business in a constructive, collaborative fashion with the NHS. And the slide effect, I'm not going to talk to this slide, it effectively describes the 4 pillars around which we kind of construct our work programs. A lot of it is about the way our business does commercial and market access work with the NHS. The NHS is by far the biggest customer that my industry works with. We're a pretty small team, but we're credible. Within my team, we've got knowledge of a various number of aspects, from how ethics and compliance is changing the industry. John talked about, do we need a Sunshine Act in the UK? Well, actually, with my sister association, EProcurement in Brussels, we will be implementing greater transparency in how the industry works with healthcare professionals. That's a journey that we started probably about 1.5 years ago. Yes, it has some genesis within the Sunshine Act. That is part of the Obama administration's Affordable Care Act process of healthcare reform. But it'll be tweaked to reflect the dynamics within Europe. We have expertise in regulatory, and there's a lot of change in regulatory as well, and clearly any process of renegotiation between government and Brussels on the European situation is going to reflect regulatory. But a lot of our work is about economic growth and market and commercial access in the NHS, and I and my colleagues lead a fair good chunk of that. So that's ABHI. I've been asked to talk about the e-procurement strategy, but in reality, a lot of this is also more widely about procurement and procurement improvements. I've kind of got 2 messages really to talk about in terms of industry's view about e-procurement, GS1 and the like. And that is why, what's the benefit? And the other aspect is about the how. So how are we going to support partners like GS1, support DH and other central government bodies to reap the benefits of the changes to e-procurement strategy? The slide here reflects the changing nature now in terms of that call to arms. So the operational efficiency piece. if the beacon to try and make that practical, tangible, realizable is going to be about Lord Carter's model hospital, then I think that's a really, really good starting point to kind of think about how we can combine all of these aspects of benefits: operational efficiency, patient safety, the increasing requirements to support regulatory compliance, plus aspects associated with transparency and openness. Bridge that across to outcomes and quality. So one of the aspects that really interests me about how we can take standards forward is to the conundrum that John spoke about earlier. All of this spend, my members, for a typical foundation trust, 8% of their operating income is spent on the category that contains medtech and diagnostics and devices. That 8% has been stable over time. Now, it's a question, I guess, about how we use that money effectively. And information is going to be critical in ensuring that we do use that money effectively to drive some of those efficiencies over the longer term, with quality, safety, and outcomes in mind. So our members are very clear on this. The e-procurement strategy in particular, GS1 standards as part of that, addresses a clear need around benefit. But there are challenges. And to their credit, the Department of Health understand this. The timelines associated with implementation of some of the elements of the GS1 piece, which is quite technically difficult in itself, those timelines are challenging. Now, I know that there's some flexibility in the timeline, so that which is a great thing, and it's fantastic that the feedback that we're offering is being heard. But the e-procurement strategy and some of these standards are hugely technical in complexity. So when it comes to kind of driving some of the change, which is what some of this challenge really is all about, the change curve, then technical complexity is one part of it. But actually, it's also about the behavioral change that's going to be necessary to drive some of the benefits that I spoke about before. The technical piece, and I spoke about this at a session that Lord Hunt and Glenn organised at the Confederation event yesterday. The technical piece, can be slowly over time overcome. So we're talking about, when we think about GS1 standards, for instance, barcoding, product labelling, manufacturing processes, those take time, but they're not insurmountable. The aspect for me that I think that perhaps the strategy is a little light on, and I hope this will kind of come through with Lord Carter's efficiency report, is about the behaviour change. What I spoke about last week was on the two sides of the equation, the supply and the demand side. If we are going to drive efficiency, then we're going to be working on a different basis of behaviour. So that's at very tactical levels. It's going to be about saying, orders won't come in manually, for instance. It'll be about clinicians modifying some of their kind of variations in clinical behavior as well, which will manifest on my industry. The industry understands that, and it's supportive of the drive to about behavior change that is going to drive some of this change in efficiency that's required. But there are also challenges, coming back to the technical complexity. This is a non-exhaustive list. It's not in a order of priority here. That there is an aspect about direction and guidance that's required to help that spread of membership get to a point of readiness in terms of implementation and then effectiveness as well. So again, I'm very grateful that the department is taking that feedback and responding. Part of the behaviour change then is about how the NHS is also going to move in the context of e-procurement, in the context of standards and improving the notion of the scarcity of information, how the NHS is going to move in a coterminous fashion, i.e. hand in hand, with industry to try and implement all of this. Because to me, it strikes me, it makes no sense if industry is working towards one channel of readiness and the NHS is working to another channel of readiness and the two do not meet. It is absolutely critical that those two elements of the supply and demand side equation that I mentioned come together. They are coterminous, because without that reciprocity, we are not going to drive any of this benefit in efficiency. That's absolutely critical. So that's just some anecdotal aspects. So here's a survey that my colleagues kind of conducted, and it's just a snapshot really to try and accentuate and you know, reinforce to you that these aren't aspects of an industry view that I'm making up. This is exactly what our members are telling us. There is no standard blueprint in terms of implementation. At the risk of stating the obvious, ladies and gentlemen, from large to small organizations, people are working at a different pace, and therefore readiness of organizations, companies are at different points of that readiness change curve. And this is why it is so critical to try and get that coterminus with the NHS. They do want more hand-holding and signposting. And they do want more information to help them assist the NHS and assist their partners in the department to get to that point where, say for instance, in that model hospital that Lord Carter is going to talk to, you know, we can say this is how industry and the NHS can work together. So a bit about ABHI, you know, what are we doing to help 3 tiers of our stakeholders in this, our members? That is really, much of it is about support and networking. Help people to address some of the concerns that came through in the survey as regards readiness, being able to implement. With the Department of Health and other government bodies, that is primarily associated with providing the feedback and responses to consultation, gathering our bottom-up perspective, collating it, aggregating it, and feeding it across to DH to then come back and assist us with some of the queries. It is about working with partners like GS1 and others. So a number of my colleagues are on the healthcare user group for GS1, and my chief exec is part of the advisory group for GS1. We recognize the importance that GS1 and GS1 standards are going to make in being a critical enabler to resolve this issue about primarily, it's not just about this issue, but primarily about that scarcity of information. Next steps to kind of try and bridge on this. So we will continue to be providing information and guidance to our members. That could take many forms, workshops and seminars. We are already working with Steve and Owen and others in the Department of Health to continue that further engagement on aspects such as the supplier guidance. And I know that the rest of today and tomorrow, some of that information will be cascaded out. There are some, again, coming back to the technical complexity, there are some issues around aspects such as managing the sensitivities around pricing attributes, how you construct that in the technical architecture that's going to make GS1 standards and other enablers operate effectively. John talked about the demonstrator sites. You know, that sounds hugely interesting. I think it'd be great if industry could engage in parallel with the Department of Health on those demonstrator sites to eke out, again, the benefits. And then with partners, you know, this is about implementation. We all know the challenge, we all know the aspiration. The piece here, I guess that's the next step, is an implementation. So to summarize, ladies and gentlemen, you know, we have that call to arms, we know what it's all about. So eProcurement and the aspects that we're trying to do here in terms of taking costs out and operate more effectively, this is really a very strongly mutual agenda between the NHS and industry. So trust is a critical aspect that we're going to have to bridge. Mutuality is already recognized. Let's focus on the prize here. We've got £22 billion worth of efficiencies. If we follow the Tesco's principle of every little helps, then you know, we're on the right track here. So let's focus on that prize. The bigger prize is going to be about how in the longer term we can get technologies embedded into the healthcare system to help the workforce work more productively, drive the benefits to patients and the healthcare system as well. Collaboration is key. It's a great start today, and I look forward to working with Glenn, GS1, John and the department, and our members, others in the audience, to try and make this happen. Thank you.